Okay, and you can't stop asking questions right now about the impact of using GLP-1 drugs. So we're following your clicks and curiosity. It looks like you also want to know more about the effects it has on the body and the digestive system, and what to know about the benefits of taking supplements. So let's break that down. We've got Dr. Avlin Imaeda up first, then our Dr. Darien Sutton. Thank you both for being here on this important topic. So let's start on the effects here of GLP-1 medications and what they do to the body and digestive system. Gastroenterologist Dr. Avlin Imaeda joins me now for more on this. Doctor, it is good to see you. Thank you for being here. So each GLP-1 drug on the market right now has a lot of similarities, but there are still differences, right? What are you noticing in your research on how these drugs work and really impact the digestive system?
So first of all, I would say that these drugs are extremely effective for weight loss. We've never had anything like this other than weight loss surgery. So nothing in a medication that's given this level of weight loss. So it's really a great privilege to be able to take care of patients that have struggled with obesity and be able to offer them solutions that work. They do have effects on the GI system. So the GLP-1, which is the primary receptor that's impacted by most of the medications. Tirzepatide also impacts another receptor called GIP. But GLP-1 actually does cause a delay in gastric emptying. So that means that when someone eats, the food stays in their stomach longer than usual. And so that slows digestion. That effect is probably in part responsible, but not completely responsible for the weight loss. The drugs also impact the brain, and that effect seems to last. The impact on the slowing of the gastrointestinal system, there's data suggesting that that actually goes away with time, particularly on the long-acting medications as opposed to the ones that are given daily. So they do have that impact. People can notice things like constipation, they can have nausea, but there's certainly ways to manage those conditions.
And we've seen a lot of talk about that constipation that you're talking about. So how should a patient address something like that chronic constipation?
Well, first, just starting with mild interventions, maybe increasing fruit intake. Other fiber supplements can be helpful along with sufficient water intake. And then if they need additional help, they can take things that are over the counter like Miralax or Senna. And if those things are not helpful, then talking to their doctor, either their gastroenterologist or their primary care doctor, about prescription medications that can help with constipation.
Doctor, what about the rapid weight loss that some people, of course, experience here? What would you say falls under the buckets of, concern and normal?
Yeah. So I will say that everybody responds very differently to these medications. We'd like to see people lose about 1 to 2 pounds per week. That's usually safe. It also depends on where they're starting from and how much weight they actually need to lose, which is somewhat determined by what health conditions they have related to their weight. But generally, we think 1 to 2 pounds a week is pretty safe. And so that's our goal.
All right, Dr. Avlin Imaeda, thank you so much for your expertise. We appreciate having you here on Search. Thank you so much. All right, let's go ahead and bring in our medical correspondent, Dr. Darien Sutton, right now. All right, Dr. D, so for those taking GLP-1 drugs, what should they know about before taking supplements, other supplements?
I think, Gio, number one, you want to make sure that you know that these are real medications, real interventions that require medical supervision. The weight loss can be dramatic, anywhere from 15 to 20% with some of these GLP-1 products, compared to 5 to 7% that you typically see with lifestyle intervention. I think what's also important for patients to know is that as these medications take effect and you see that appetite get reduced and you start likely consuming less calories, you want to make sure that your body gets what it needs, and that is from whole foods, and then supplements can help to fill in that gap. But you want to make sure that you're doing this with a medical provider, and if you can, a registered dietitian to help optimize your diet for you.
That's right. Always speak with the dietitian and your doctor. Okay, so the use of skincare creams and pills, that's really become a trend that influencers, they're promoting online. We see it all the time, claiming collagen and retinol will help fight against that so-called Ozempic face that people are talking about, loose skin that comes from rapid weight loss. Help us understand what's fact and what's myth here.
our medical unit has gotten a lot of these questions. So this is a little bit of fact mixed with a lot of magic marketing. And to understand this, retinol, there has been evidence that it stimulates collagen and it can have modest improvements on your appearance. Also, there's mixed evidence that collagen can lead to some mild improvements. But I think what's important to know about this is that when you see rapid weight loss and that facial weight loss, that facial volume loss, that most often is due to how fast you lost that weight, how much weight you lost, and your age and your genetics, not necessarily due to any other thing that you can reverse or take over the counter. So I would advise people to be weary of any product that advertises treatment for something like Ozempic base. It's not technically a real thing. You want to make sure that you're talking to your provider and optimizing the other things that you can change that have data behind them.
So what supplements should you avoid if you're taking GLP-1 drugs?
Well, from my emergency medicine perspective, I always want to caution when you see a supplement that has advertisements for fat burner or stimulant on it, those are dangerous. You want to make sure to avoid those if you're taking those with a GLP-1 like product. Other supplements that might interfere with your insulin management, this is, for example, of certain medications or over-the-counter medications like berberine or ALA, alpha lipoic acid. If you're taking those supplements or any supplements, you want to make sure to bring all of them with your medications to your provider to make sure that you talk about possible medication interactions.
That's right. Really important because some of those actually act like even natural GLP-1 kind of drugs. So it's important to look at all of that. Thank you so much, Dr. Darien Sutton. Appreciate you.